Hi, I'm Christopher King. I'm the Associate Medical Director of the Advanced Lung Disease and Transplant Program at Inova Fairfax Hospital in Falls Church, Virginia. In this video, we'll be talking about treating pulmonary hypertension and specifically the nitric oxide pathway, which is one of the 4 treatment pathways that we have in pulmonary hypertension. So nitric oxide is a substance which can lead to pulmonary vasodilation. So there's a number of medications that work to increase the production of nitric oxide. And so we're going to talk about what those medications are first, and then we'll talk a little bit about how that pathway works. And so all the medications within this class are oral. They do have some side effects, including low blood pressure, heartburn, visual changes, but the side effects differ for every single patient, and some patients have very minimal side effects. It should be noted that you can't use more than one medication from this class together because it can cause drops in your blood pressure. The medications that are in this class are broken into 2 categories based on their mechanism. So the first category of medications are what we call phosphodiesterase type 5 inhibitors. And in the next slide, I'll explain a bit more how they work. But the 2 medications that are found in this class are sildenafil, which goes by the brand name Revatio, and tadalafil, which is marketed under the brand name Adcirca. There's also another class of medications which can lead to increased nitric oxide synthesis and pulmonary vasodilation called soluble guanylate cyclase stimulator medications. And so the one medication available in that class is riociguat, which is marketed under the brand name Adempas. So how does nitric oxide work? Well, it's produced by from a substance called L-arginine by an enzyme called nitric oxide synthase. And this nitric oxide will stimulate soluble guanylate cyclase, which is an enzyme which can convert a substance called GTP into cyclic GMP, which leads to effects including pulmonary vasodilation. There's another substance called phosphodiesterase 5, which can inhibit that act. And so the medications sildenafil and tadalafil block phosphodiesterase 5, and which again inhibits the production of cyclic GMP and this production of nitric oxide, whereas the medication riociguat stimulates soluble guanylate cyclase, which leads to these increased cyclic GMP levels. All of that can be a little bit confusing, but the important thing to remember is both of these categories of medications lead to increased pulmonary vasodilation and sort of effects on this nitric oxide pathway. So these medications are commonly used and incorporated into the treatment plan for pulmonary hypertension. The mechanisms that lead to development of PAH are complex. There's a bunch of different pathways that can cause increases in pulmonary pressures, and your clinician will use different medications to try to target multiple pathways in many instances. There's 2 different types of oral medications that can influence the nitric oxide pathway in pulmonary arterial hypertension. And while these medications are frequently used, remember, they can't use more than one of these medications together. Thanks for your attention. For more information or resources, please visit phassociation.org.